And we welcome Jerry Johnson from Marble City Pharmacy this morning on Health Monday. And good morning to you, sir.
Good morning.
It is a special day today, Veterans Day 2019.
It's a special day. I love Veterans Day. You know, probably said on this show before, but my granddad was a veteran. He's a Purple Heart guy. My wife worked at the VA for 10 years. So I tell you, the Johnson family loves Veterans Day. And I'll say this, you know, they thinking about these guys, especially the older guys who are veterans, they don't make them like that anymore. No. You know? No. So we love Veterans Day. Thank you to every single one of you who have served and are serving currently. You've made our country what it is, and we appreciate that.
And you've got a lot of patients that are veterans, too.
Got a lot of patients that are veterans. So listen, we're going to be there today. Come on down and visit with us. The pharmacy has to stay open, so we're thankful for your service.
It's that time of the year again. Actually started mid-October, continues through early December. Medicare open enrollment.
Boring, confusing, all of those things, but necessary. That's what I was telling Jimmy Dale. It's not exactly exciting, but it is necessary for us to talk about this time of the year for sure.
Talk about Medicare versus Medicaid. That is confusing enough right there.
It is confusing enough. It's almost like they need to change the wording so the letters aren't so similar. But Medicare, right, is your federally funded health care program for people who are in one of three categories: over age 65, on disability, or with end-stage renal disease. So that's who's eligible for Medicare. That's your red, white, and blue card if you're confused about the ones that are in your wallet. Medicaid is a state program. It does take some federal funding, but it's a state program. It differs state by state in some ways, some things in common, some things different. That's mainly a program based on your income, a lower income type program. Serves a lot of children. In fact, I think Medicaid serves in the millions of children in Alabama.
A, B, C, D. I don't know how far we go in the alphabet. What's this all about?
That's confusing too, isn't it? Medicare Part A is your hospital insurance. So if you pay Medicare taxes during your working lifetime, you get Medicare Part A at no cost to you per month. Medicare Part B is your physician insurance. It's also used to pay for things like lab tests and testing supplies, for example, if you have diabetes. Medicare Part B, though, does have a monthly cost attached to it. I can't remember what it is. It's somewhere in the $130 range per month this year. Medicare Part D, it's easy to remember, right, is drugs. Medicare Part D are your drug plans. They're separate from Part A and Part B, or at least they can be, because Medicare Part C is another word for Medicare Advantage plans. And Medicare Advantage plans take Part A, Part B, and Part D and wrap them all together and farm them out to another entity. That's confusing, isn't it?
Yeah. You know, I'm 68 years old, still in the workforce, but I get all this stuff in the mail about Medicare and stuff like that. But the pros and cons of the drug plan only versus Advantage plan. What is this?
Well, I'm thankful you don't have to deal with that, by the way. You know, you just work forever, then you won't have to. The drug plans versus the all-in-one, they do have pros and cons. And I'll say this. If you're somebody who doesn't use much health care, think of a better way to word that. If you don't go to the hospital very much, if you don't go to the doctor very much, one of these all-in-one plans may be right for you because the monthly cost for those is significantly lower. However, you do get knick-knacked on your copays. I had a guy telling me just the other day, I've got to get out of this Medicare Advantage plan because I've paid so much in copays throughout the year, I would have been better to do something different. So basically, if you do A, B, and D separately, your upfront costs are going to be greater, but your back-end costs are going to be less. If you do a Medicare Advantage plan where they're all in one, your upfront costs are going to be less, but your later on costs potentially might be more.
And as we grow older, this in our minds a lot of times becomes more complicated.
It does. Listen, you know, as I'm getting older, it becomes more complicated. When they first came out with this, man, I can't remember. We're probably 10 years or so into these maybe 15 years into these drug plans. I spent a ton of time researching this just so I could get my mind around it. And I have to do the same thing each year. It takes me a few days, maybe even a few weeks of real study wrap my brain around it. And that's for somebody who, at least theoretically, should be an expert in these things. So if it's confusing to you, I understand that. But of course, we're here to help you work through that.
Talk about the Medicare supplemental plans.
Yeah, Medicare supplements, probably the most famous one, or not famous, but probably the most well-known one in Alabama would be Blue Cross Blue Shield C+. That's just a good example for you to help you understand. Medicare Part A and Medicare Part B pay 80% of whatever your cost is at the hospital or at the doctor's office, but that leaves you with 20%. Mm-hmm. And as you can imagine, especially in the hospital, that could add up to quite a bit of money. So Medicare supplemental plans are there to pay the other 20% that Medicare itself doesn't pay. Mm-hmm.
Now, the Medicare open enrollment continues through December the 7th. How do the Medicare drug plans differ?
Whew. Okay.
We only have a couple of minutes on that.
Yeah, no joke. Okay, Medicare drug, let me try to make this as simple as I can. Medicare drug plans differ in probably about 4 ways. Number 1 would be whether or not they have a deductible. You guys know what a deductible is. It's how much money you have to pay, where you pay 100% before the plan actually starts working. The standard deductible for 2020 is $435. So deductible is number 1. Number 2 is what the copays are after you meet the deductible. So let's say you take a brand name blood thinner and it's $40-something on one plan, $50 on one plan, $75 on another. So they can differ on copays. Number 3, they differ in, I didn't even talk about the monthly premium, did I? They differ in the monthly premium. So you got some plans that cost as little as $17 or so per month, others that cost as much as $120 per month. So you can imagine how difficult it is. I mean, you want one that's cheaper per month, of course, but you also want one with good coverage. And then the 4th thing, and this is how it becomes much more individualistic, is they differ on the drugs that they actually cover. And then the copays that they charge for those drugs. That's where it becomes difficult.
And there is a coverage gap. Explain that. And also, does a coverage gap exist with all drug plans?
Yeah, the coverage gap, sometimes for slang, is called the donut hole. If you guys are already on Medicare, I imagine that you've heard of this. But if you're new to it, be sure that you understand there's a deductible period, there's a primary coverage period, and after you've built up a certain amount of dollars in drugs for the year, you enter a phase called the coverage gap. And during that coverage gap, the copays that you've been paying don't apply anymore. And so you have to pay 25% of the cost of your medication in 2020. That goes for brand and generic. So you could imagine if you have a $400 medication that you've been paying $40 for, you know, you're good at math, right?
Oh, yeah.
25% of $400 now becomes $100. And so you can see those copays on certain drugs skyrocket, and that becomes a very difficult time to manage for a person on a fixed income.
So what should our viewers do that are looking at the Medicare and Medicaid? What should we do before we choose a plan for the next year, which is what we're dealing with now?
Yeah, to figure out the right plan for you, it is tailored around your particular medication. If you don't take any medication, it's very simple. You can sign up for one of the very cheap plans, and then you have what insurance is meant to be.
But that's unlikely for a lot of our viewers, though.
It's unlikely for just about anybody, right? I'm 42. I take more medicine you could possibly imagine, right? But it's highly tailored around the specific medication that you take. And so first you have to make sure that the plan covers all the medication, that they're covered drugs on their formulary, it's called. And then you have to compare what the costs are going to be for the copays. And so that can be done on the Medicare website. That can be done by calling Medicare. That can be done by calling the individual plan if you're already on one. Although at times even that can be confusing.
And, you know, to talk more about this, y'all got a listening ear and have some information on it as well.
We do. In fact, I'll tell you where I'm headed right now. As soon as I get out of here, I'm headed back to the pharmacy so that I can work through the list of people I'm trying to help right now. I have a very long list of people who trying to help them understand more about it, to find the plans that cover their drugs and give them some good choices. So if you are having trouble, you are confused, if you're at a pharmacy where your pharmacist is not help, I don't want, that sounds rude. If you're not getting the help you need, you should come see me.
And of course, they are open today, right?
Open today.
And the change of the season, we've got the holiday season coming up, and a beautiful, beautiful gift shop too.
Beautiful gift shop. It's ready for Christmas presents. Got gifts for anybody on your list, and it's wild right now. Everybody seems to be sick, so come on in. We can help you whatever you need.
And if someone has questions, that is kept in-house, and what they talk to you about is you don't share that.
Oh yeah, sure. We don't tell people your medications. Some of these Medicare plans have extra help, or they have something called the low income subsidy, where if you make less than a certain dollar amount per year, you qualify for that. We certainly don't share any of that information either, or anything of a sensitive nature at all.
All right, Jared, thanks for being with us this morning.
All right, very good.
Jared Johnson from Marble City Pharmacy, our guest this morning. Final check on